Naam, karibu. Kabla tuende katika mazungumzo ya leo na kufahamisha tu kwamba aliyekuwa waziri wa afya Nakhumicha hatimaye anampokeza ofisi waziri mpya wa afya Daktari Deborah Mlongo. Ni mwezi mmoja tangu Rais William Ruto kufutilia mbali baraza lake la mawaziri kufuatia shinikizo kutoka kwa vijana. Waziri mpya wa afya anachukua wadhifa huo wakati ambapo ugonjwa mpox unahangaisha baadhi ya mataifa ya bara Afrika. Kenya imerekodi visa viwili kutoka kwenye mpaka wa Malaba na Taita Taveta.
So we can go ahead and sign. Hurry.
So now you can exchange one palm that you did.
No, it's me giving it. Yeah. Thank you. All the best. All the system. All the best. Thank you.
I could read through you.
So we'll give you 1 or 2 questions for each of them, and then we can close.
Once you want to answer, ask a question.
No, I could read. I could read through your lips. I could see.
To the upcoming CS, you've spoken about the achievements, the things that you're very proud of having done where you are the Ministry of it for a short time. Perhaps you could also tell us just your biggest regrets, what you set out to do and what you didn't do, and what pieces of advice you have for the incoming CS so that she may perhaps not encounter whatever challenges you had in your team.
Just that?
Yeah, that was my question as well.
Okay, thank you very much. Wow, you asked whether there were any regrets. Is there anything I regret? I think there's always room for improvement when you have a responsibility ahead of you. So there are things that we could have done better, maybe, under the circumstances. And I want to take it as a part of the journey of this job. Even when you think you are doing good, you remember the law of unintended consequences, you know? That you have planned to do the very best, but you end up with unintended consequences. For example, I really regret the time the doctors were on strike. It was quite a low moment for us as a ministry. You know, having to see that there are patients who need to be served and the doctors are not there to serve them. I must say that is one of the things that really was a low moment for me as I worked here. And but otherwise, we managed very well. Even during that time, we still worked as a team and managed the situation as bad as it was. So I think for me that would be the downside of my tenure here. And advice to my incoming sister, I don't think this time is enough for me to give you enough advice. But what I can say is that as a leader, there's no written, the way you do your things. except that you have the Constitution of Kenya, you have the Health Act, you have the act that we did recently, you have the ministry policies. So if you work within that parameter, you should be able to navigate. But also to assure you that I'm available, my sister. Should you need anything from me, I'm available to tell you how I went through it, and wish you all the best in terms of managing the rest of the issues. Yeah. Thank you. Thank you.
And to the incoming CS, perhaps, what is that one thing you would want to do, even as a check-out here in Kenya? That's just one thing you want to do, like that doing this as well as her main aim is to ensure universal coverage. What about you?
Yes, thank you so much. And as I said earlier on, even during my vetting, being a medical doctor, working in the slums of Nairobi, working in the various areas, seeing underprivileged people in the community, indeed, Kenyans are not getting affordable, accessible quality care. We are seeing that the private sector, yes, when you have money, you are able to access, but for the underprivileged or those with low income, they are unable to access care. So I believe that my sister laid a very good foundation in setting up the laws. And for me, I believe that ensuring that this is implemented to the last step is really critical. And it's actually aligned to the Sustainable Development Goals, the AU, the Vision 2030, aligned with even the government's agenda. So that would really be a win for the Ministry of Health if we are able to have all Kenyans able to access affordable quality care. So we'll run with that and also ensure that the quality of care bill as well as HRH, they are passed, and that way we are able to ensure that there's sustainability and that Kenyans are able to access affordable quality. Equally, the issues of human resource has been a challenge. Health workforce has been a challenge. I empathize with the health workers, not only the doctors, but we have the nurses, the clinical officers, the physiotherapists, among others. So we really need to also carry on and see how we can ensure that the health workforce have the appropriate environment, the occupational environment in order to deliver the services to all Kenyans. So that is also one of the critical areas. Again, following the president's, one of the areas that he wanted us to look at is the exploitation of labor, and we have the nurses, we have other occupational therapists, the physiotherapists, and other health workers. So we need to capacitate them and really improve in those areas. So those are some of the areas that we need to really look into. But I think the greatest achievement for me would be the implementation or the operationalization of UHC so that we can serve all Kenyans and give them affordable, accessible quality.
Maybe what the former CS talk about lack of resources in running the ministry, because we managed to come up with better policies, and we are talking about CHCs and other human resource, other policies that are currently being implemented. And possibly, how are you going to handle this issue on resources, lack of resources, to ensure all these policies and all that you set in place are actually?
Thank you very much. As my sister, CS Nakhumicha, has clearly said, yes, the resources are diminishing. We need to look at a way where we can have pooled resources, and that is where the social health insurance funds comes in. So if we are able to get that up and running, then we'll have resources to be able to sustain health services or healthcare in Kenya. Equally, we look into the issues of resource mobilization, being able to map out partners around, and during the transition time, we can see how we can increase the resources so that we ensure that services are also up and running. So we'll be mapping out, we'll be engaging partners so that we can see during this time how we can support health service citizens.
recently we announced that Kenya has become a safety case of bearing in mind that we see Nigeria Uchungu was able to refuse tender on the basis of vaccine. Has Kenya made any form of request to get any issue? And if so, how many and where?
So indeed, for the monkeypox response, vaccination is indeed a critical pillar, and we need to ensure that we have improved vaccine capacity for Kenya. So seeing this is a technical and an operational question, I'd like to hand it over to the Director General to tell us how we are progressing with that.
Thank you, Madam Waziri. Yes, very important. Thank you, Madam Waziri. We reported our second case of Mpox last week. A truck driver who came from the epicenter of the outbreak in the Democratic Republic of Congo. Africa as a continent requires 10 million doses of the Mpox vaccine. Discussions from the Africa CDC indicate that Africa would be able to get about 2 million doses of the vaccine by the end of the year, if you have discussions with the manufacturer, that is Bavaria Nordic in Copenhagen. However, you must remember that Mpox is endemic in Nigeria, unlike Kenya, which reported the first case of Mpox this year. The burden of disease is greater in Nigeria, and therefore the allocation of the vaccines will be based on the burden of disease. We are still in phase 1, where we have less, in terms of our response plan, we have 3 phases. Phase 1, less than 99 cases. Phase 2, 100 to 1,000 cases. Phase 3, more than 1,000 cases spread all over the country. So for now, vaccine will not be a top priority. We need to put in place the infection prevention control measures as our main prong of control of Mpox. When the cases, there's a surge in number of cases, then consideration will be made into the use of the vaccines at that particular moment. Thank you.
Thank you very much, ladies and gentlemen. We appreciate you. See you.
Thank you.